Is your child having difficulties at school? Could a vision problem be to blame? Hello and thanks for joining us. I'm Jill Horner. This hour's newsmaker is Kimberly Friedman, president of the New Jersey Society of Optometric Physicians. Thanks for being with us, Dr. Friedman.
Well, thanks, Jill. It's a pleasure to be here.
We're talking about the importance of pediatric eye exams. Now, when we take our child to their pediatrician, is that eye exam sufficient?
Well, actually, most parents believe that it is, but unfortunately, the screenings that occur at pediatrician's office and at the school nurses in preschool and in elementary school are often insufficient to actually diagnose many of the eye problems. While those screenings are excellent at picking up signs of nearsightedness, sometimes astigmatism, they often will miss things like farsightedness, whether or not the two eyes are working together as a team, depth perception problems, things like that.
If a child has an undiagnosed eye problem, what problems could it lead to in the future, maybe at school or maybe for health reasons?
Right. Well, unfortunately, if a vision problem goes undiagnosed in the early years, it can really lead to a lot of learning difficulties. Studies have shown that 80% of learning is visual in the first 10 years of life. So if you have any type of undiagnosed vision problem, very often it will display itself in school. Maybe children are sometimes misdiagnosed as actually having attention deficit difficulties, maybe some learning difficulties, maybe that their attention can waver a bit in some of the classroom activities, when in reality it's just simply a vision problem that has not been diagnosed.
Let's talk about some of the signs and symptoms before your child even becomes school-aged. What about babies? How can we determine if they do have a vision problem?
Right. Well, obviously babies and even toddlers are not going to come up and say, hey, Mom, I have a problem with my vision. Basically, what you can look for in those age ranges are things like turning away from lights, covering one eye, tilting the head to the side, not seeming to be interested in faces, in playing games, things like that. But quite frankly, very often you really need a comprehensive evaluation to be sure that things are developing properly through infancy and toddler years.
What about after the toddler years, into the school years? If a child is having difficulty reading, for example, would that be an indication of a potential vision problem?
It can be. Very often children that have undiagnosed vision difficulties will do things like constantly losing their place when they're reading, maybe taking additional time to read a subject matter, maybe poor comprehension level in class, difficulty even in math, because in math sometimes visually they can't add the columns appropriately because their vision doesn't, their eyes don't scan through the math problem properly. Also you'll see issues, the obvious issues like not being able to copy from the blackboard or see the blackboard clearly, things like that.
Are there any guidelines as to when we should take our kids for their first eye exam?
Right. Well, believe it or not, children should actually be seen for their first eye exam in infancy. They should be seen before the age of 1, then again around the age of 3, and then again prior to entering kindergarten. At the early examinations, the infant's examination, we're looking for any congenital or difficult things that could be wrong with the eyes that a child might be born with, any developmental problems with the eyes. At the 3-year-old examination, we're looking specifically for amblyopia or lazy eye. That's when the two eyes are not communicating effectively as a team and possibly one of the eyes isn't capable of seeing 20/20. And that developmental problem is much easier to fix if we catch it in the first few years of life.
Take us through the eye exam process when we bring the child into the office.
Right. Well, first thing you want to do is make sure that prior to coming into the examination that you let them know that it's not the same as going to a pediatrician. A lot of times children will associate a doctor with shots, and they need to know that coming to the eye doctor is fun, we play games, and depending upon the age, we're just doing things like using different lights, looking at different pictures, utilizing different charts that the children play with, and it really is a fun experience for the child. It's not something that should be traumatic at all.
And we have to remember that glasses are a lot better looking than they used to be for kids.
Right now, actually, my biggest problem in the office is having 4 and 5, 6, 7-year-olds that I have to tell that they can't get glasses when in reality they come in wanting glasses.
All right, some great advice for parents. Thanks so much.
Thanks, it's a pleasure to be here.
Thanks for watching. We've been talking with Dr. Kimberly Friedman, president of the New Jersey Society of Optometric Physicians. I'm Jill Horner for Comcast Newsmakers.